Newman, and my concern is the birth rate in unwed mothers and having to pay for 18 years of that. And when is that going to be addressed?
You know, you are right in the sense that if we don't have an intact family structure, we're going to have lots of social ills. Okay? Now, I'm not sure, though, that we can influence. I'm going to say two things. So I'm not sure that, though, that the federal government is able to make. The federal government does not want to make decisions regarding morality. The federal government does not want to say that anything is wrong. Okay? I'll just say that. Now, that's Washington, D.C. So in terms of unwed mothers, that is an issue that the federal government is not going to touch in one sense. In the other sense, there's also a perspective I'll take as a physician. It's not the baby's fault that the mom is not wed. And we got to take care of that baby because otherwise the baby will come into life maybe in ill health. And so we as a society have got to recognize that the baby has to be cared for, and taking care of the mama before she delivers is good for the baby. That's the next thing. Thirdly, though, you are right in that sometimes federal programs make the situation worse. If we say you get benefits if you're not married, but you don't get them if you are married, that's wrong. And we're actually working against ourselves as a society, and ultimately we're working against the best interests of that baby. Because the baby's going to do better if the mama has someone to help her raise the child. My wife is a retired surgeon. She probably operated on some of y'all. I'm a doc. We got 3 kids. And at the end of the day, I'm looking at her and she's looking at me and we're thinking, how in the heck are we making it? And I have nothing but admiration for single moms who are able to raise children on their own. My son's 14. He's feeling his oats. I got a child who's 11 and another who's 7 who I like to say is a future inmate. And so, you know, and to get their homework done is hard. And today, my daughter, I take him to school, was late for the 4th day in a row. So how does a mama do it? I don't know. But we can't make it worse by creating federal incentives for that particular situation. So anyway, I'm kind of with you on your concern. Melissa, I can't see you. You got somebody?
Anyway, what I want to ask you, no matter what health plan Republicans or Democrats they pass, as long as illegal aliens can come in these hospitals and get free medical care while all the rest of us are working all our lives, no matter what system y'all putting in power, it's going to still suck the system dry. If I'm not mistaken, I believe there's 12 million people uninsured, but 7 million of them are illegal aliens that's sucking the system dry. And to me, I think it would be enough money to go around for everyone. You know, I agree with your system the Republicans are trying to do 100%. But on the other hand, if you don't stop the illegal aliens, the politicians, instead of worrying about votes, this country is going down the drain. No matter what policy you put in power, it's going to suck it dry.
I agree with you. In fairness, they said 47 million people are uninsured. About 10 million of those are illegal aliens. And frankly, your voice has been heard loud and clear, so even the left of the left in Washington, D.C. says that this policy, this plan, whatever comes forward, will not cover them. So your concerns, sir, and the concerns of others have been heard, even by those who are most left. And in fairness to the plan before us, it's not going to, they say at least, it won't cover illegal aliens. Well, it would cover their children if their children were born here, in which case they'd be U.S. citizens, and that's another argument. That's another discussion.
I work for the parish, and I've recently obtained a master's degree, so I'm a professional. My husband was laid off from his job 2 months ago, and I had a baby about 2 months ago also. In order for me to cover him under my employer's plan, I would pay almost half of my take-home pay in insurance. We were able to get a separate plan for my husband and my newborn child, and I'm still paying almost a third of my take-home pay for health insurance for them for a plan that only covers major disasters, so we're still paying out of pocket for all of the small expenses. how does my current situation differ from your health savings account? Because I am paying out of pocket for small procedures for them.
Oh, well, a couple things. The way it differs, and I don't know the particulars of your policy, okay, so I'm not an HR person, but one thing I'll say about an HSA is just like insurance premiums, you fund it with pre-tax dollars, okay? So if you're in the 25% tax bracket, then you're paying for your insurance or for your HSA before you pay taxes. So you get a 25% tax break, if you will. Now, there's a few problems with that, because that means that if you're earning $1 million a year and you're in the 35% tax bracket, you're getting a 35% break. And if you're in the 10% tax bracket, you're only getting a 10% break. Now, frankly, I think that's wrong. I think you need to turn that pyramid upside down so the person who's lower income gets the bigger tax incentive and the people whose upper income gets the less tax incentive, okay? But that's one of the reforms that I would advocate. But so not knowing the particulars, so I can't comment upon, your in terms of your policy structure, income, etc. But I would say if you go to an HSA, you would at least get, depending on your income, a 10 to 35% tax break in funding your HSA, because that's the amount that wouldn't be taxed by the federal government. Does that make sense? And so that's the advantage of it. And so if you will, the money you put into the HSA, depending on your tax bracket, is a more valuable dollar than the money you pay straight out of your pocket. But I think we could strengthen that by, for lower income folks, giving a better tax break than we do for the folks at the top of the income. Make sense? So, thank you.